answer to whether there's a perfect breast, and I think this is very appropriate when it comes to talking about breast augmentations. We've got to look at differing views, as mentioned by the previous speaker. Men, women, plastic surgeons, and the ethnicity of the patient plays a difference in their view of a perfect breast. Now, this next slide, we've seen something similar already, and this is the 45-55% ratio. And this is a morphometric analysis done in a whole host of population. And it's 87% of women in their 30s choose this, 90% of all men, 94% of plastic surgeons, and if you see the bottom middle column, 87% of both Asians and Caucasians. So if we're following this, it's a good guesstimate as what most people would like. And if you look a little bit more into the details, so that's 45%, 55%, and the nipples up pointing at a 20-degree angle. And if you look at the words they use, so if you look at LPC on the bottom, that's lower pole curve, and the upper line, they've not called it upper pole curve, they've called it an upper pole slope. And I think that's important, that the natural breast, or what most patients are suggesting, is they want a gentle curve, not a concave, unless of course they want a very obviously proud breast. And there are some patients who demand that. So this is the same picture again, just illustrating the points. 45 above, 55% below, and at an angle of 20 degrees. And this is not just something new, this is apparently they've seen this in old sculptures as well. So moving on to what we do and how we try and refine this. Now I'm sure a lot of you already do breast augmentation, so I'm speaking to people who are already very experienced in this. But what we do to refine this in terms of getting symmetrical and accurate implant placement